We should mask up to combat community transmission. So just how effective are masks?
If there's any proof how quickly germs can spread, it is here, inside St Vincent's Hospital Research Lab.
This is where the war's really going to be won, in the laboratories.
A team of scientists is busy testing positive COVID blood samples from recovered patients.
To defeat the virus, we need to look at ways in which the virus is working within the body and how we can apply viral treatments for that as well.
Pathology manager Greg Granger says while their work is critical to understanding and controlling the global pandemic, he's adamant what we do to help stop the spread of COVID-19 is just as important.
We know for sure that wearing a mask and the social distancing is working, so I think what we're going to see is a representation of that under this trial.
Tonight, putting face masks to the test.
Okay, Dimity, so we've set up 3 sets of trials that we're going to look at here. We're going to look at coughing, we're looking at sneezing and talking. For each of these scenarios, we're going to look at 30 centimetre, 1.5 and 3 metre distances with and without masks.
After returning a negative COVID swab, our producer Laura will give the samples. 25 years old, Laura is healthy and has excellent hygiene.
Okay, Laura, for this first trial, I'm going to ask you to hold on to this ACA plate and cough into it at a distance of 30 centimetres.
Coughing samples are collected into separate dishes at a distance of 1.5 and 3 metres. Next up, sneezing.
So it's a bit difficult to sneeze on command, so what I'll get you to do is hold the dish at 30 centimetres and give me a nice clear ah-chew into the dish.
Ah-chew, chew, chew.
Laura is then asked to say the entire alphabet
A, B, C,
for all 3
D,
distances.
E, F, G, H, I, J, K, L, M, N, O, P.
Each test is then repeated, wearing a P3 surgical face mask.
Achoo. A, B, C, D, E, F, G.
The samples are bagged, boxed and sent off to the research lab.
Okay, so what are you going to do with our samples?
So the samples today will be handed over to a microbiologist and they'll be put it into an incubator. There the samples will be allowed to grow over the next 48 hours and we'll be able to see the results from our trial.
Shri Mika has worked in scientific research for almost 30 years.
Do you think people will be shocked at what we're about to see?
Oh, definitely, definitely. And you don't remember how tiny the aerosols can be.
Now we're all set, we'll come back in 48 hours to see the results. We're not only expecting them to show just how much bacteria can spread in our day-to-day interactions, but the main thing we want to see is just how much protection a face mask provides.
All right, Shree's set us up here.
First, the result from Laura coughing without a mask on, 30 centimetres away.
And look at that, we've got a nice bacterial colony there.
So that's a germ?
That is, so it's a pathogen, it's a bacteria. Look, this is from a healthy individual as well. We expect that with such a close coughing simulation.
This was the bacteria caught 30 centimetres away from Laura's sneeze.
Oh my gosh.
Exactly.
That is gross.
So again, we would expect that even though it was a simulated sneeze, we know that there's some high projectile bacteria coming from Laura, and this has been shown here in the agar.
And so that could not only just come directly from someone, but if someone sneezes onto like a hard surface, that's what could be left on that surface.
Absolutely. So there would be that contact and they can be picked up on someone's fingers. And this, of course, is just a small rub of the eye or onto the mouth, and that bacteria is going to be transferred.
And this from talking, the same distance.
We would expect similar kind of trending to be happening with the virus as well.
These are the results with Laura wearing a mask, coughing.
And look at that. No trace at all.
Sneezing.
We've got nothing.
And talking.
Still nothing. This is a trend that you would expect with having the barrier, something as simple as a mask, preventing that bacterial transfer.
Now to 1.5 metres, coughing without a mask.
Again, we've had good contact there.
So socially distant, you still get bacteria travelling.
Under this circumstance we have, and look, probably you would expect that. Again, this is why it's so important to combine both the social distancing and a mask where you're able to.
Sneezing.
1.5 with the sneeze. And look, this was a little surprising. We haven't picked up anything there.
Talking.
That's actually a fungus, and probably this was born out of a contamination during the trial.
Once again, when Laura put a mask on, they remained clean. The 3-metre tests showed taking an extra step back does make a difference. No bacteria, besides a few contamination spots.
So clearly the message here, we can't be complacent.
It's clear that if that there doesn't make you want to wear a mask, I don't know what would.
The virus itself doesn't move in the environment, we move it.
St Vincent's respiratory specialist, Dr Claire Thompson.
It highlights the normal bacteria in our system going from droplets onto a surface, which is the same way that COVID is spread.
What does it take for somebody to become infected?
So one droplet can cause the COVID disease in a patient.
Researchers at the University of New South Wales have used light and a high-speed camera to show that even the thickness of your mask matters.
It's not so much about protecting yourself, it's more about protecting others, and we're all in this together and we should do whatever we really can to help prevent the spread of COVID.